Two common questions related to home-based physiotherapy. Is my home environment safe for physiotherapy sessions? How can I prevent injuries during home-based exercises? Welcome back to our channel. Home-based physiotherapy has been on rise and for good reason. Many find it's very convenient, and also it helps you to get personalized exercise programs which you can do it from the comfort of your home. For past 2 to 3 years, I'm providing Telephysio, where my patients connect with me through virtually, through Zoom calls, through WhatsApp video calls. There are so many platforms where we connect for the sessions, and it is significantly improved whatever condition they came across, because this program is tailored according to their specific needs. There are a lot of benefits when it comes to the program, but the safety is very, very important, where you have to consult with your physiotherapist. There are a lot of misconceptions and also safety concerns surrounding home-based physiotherapy. Some worry about lack of supervision, and some worry about if they do the techniques wrong, it may lead to more injury. Before we continue, if you find this information useful, please subscribe to our channel. Don't forget to share it with your friends and family. I want to share a small story. Once there was a patient who came to us and saying that they had some problem and they did home-based physiotherapy. Then I asked them how did you had any professional guidance? Did you diagnosed by a physiotherapist? How did you do? Then they said they came across a YouTube video and they had some ankle pain, so they tried whatever the therapist in YouTube channel they have said, and they did it, and it leads to more injury. That is what's here. When it comes to home-based physiotherapy, it is more effective, but it needs to be done with professional guidance. If you are following any YouTube channel or an app or Google, you study yourself. Why I'm saying this is, example, you may have a knee pain. Okay, knee pain is common to all, but the problem from person to person differs. A person with knee pain, I'll be giving different people. Okay, think person A, okay, with the knee pain. Person B also with knee pain. Person C is also with knee pain. All three are suffering with knee pain, but the person A, due to knee pain, he can't walk. So that is his major concern. But if you come to person B, he's also suffering with the same knee pain. But the problem for this person is he's finding it difficult to sit and get up. So this is the major concern the person B is finding. So person C is also suffering with the same knee pain, but this person's having only concern of climbing the stairs up and down. So the knee pain is common to all, but the problem due to knee pain, what they are suffering in their day-to-day activity differs. So the program for all these is different. The knee can be common, but the problem is different. So the home-based physiotherapy program for all these conditions might be different. So only if you seek a professional guidance, and if your physiotherapist suggests you guided exercises, if you do it, that is when you find it the result. Just nowadays you can see a lot of YouTube doctors and Google doctors are there. Even if that is said by a physiotherapist, you don't know which video, because they might have put a lot of videos in their channel. It might be for during the advanced stage of that particular condition. You don't know whether you have seen the basic one, whether you have seen intermediate one, whether you have seen advanced one. So it's always best to get consulted. There are a lot of people who provide do-it-yourself home-based physiotherapy programs. So see, without consultation, without understanding your problem, just because you have some home-based exercises for knee pain, for ankle pain, for shoulder pain, if you just follow blindly, it is not going to help you a lot. And there are so many safety concerns, there are so many do's and don'ts you have to follow during physiotherapy sessions. It might be in the clinic or it might be at your home environment. If you're not going through professional guidance, if you're not going through proper channel, and you just follow this, do it yourself, in the end, for some it might help, for some it might lead more injury to your joint as well. I will share a success story of one of our client who took our home-based physiotherapy program through Telephysio. So the patient was around 48 years old, who was having neck pain and also knee pain. Each patient have different goals when it comes to their physiotherapy programs. So this person, she loved traveling, but due to her chronic neck problem for past 10 years and also knee issues, she avoided traveling, but she loved to travel. So we prepared a personalized program for her for 6 months. She started doing it every day. We connect and online, and we were guiding her through right supervision, and before she come to us, she was wearing collar for past 2 years, and for past 10 years she was having therapists, and she was into a lot of fitness regimes and things, but nothing helped them. But with right guidance, with right program, within 6 months she went on an adventure trip. Within a week she removed her collar. She could do all our day-to-day activities within our home, and earlier she was working. Due to this issues, she stopped working, and again she started working from home. So then on our adventure trip, so whatever earlier she could never tried completing our program, she did it. So if you're looking for home-based physiotherapy with right guidance, professional help, you can really achieve the goal by just sitting at from the comfort of your home. But the safety is very, very important for you to go through the right pathways. Make sure you get assessed, you get diagnosed, and then you get a personalized program with supervision and get a regular follow-ups from your physiotherapist. Before we conclude, we love to hear from you, your experience, any questions or thoughts regarding home-based physiotherapy. And if you're having any question, please drop it in the comment sections. We'll be happy to do a topic related to that as well. Thank you for watching our video.